Thank you very much, Oliver. As Oliver said, my name is Jose Nova, and I will be talking a little bit more about the data sets available in the iPHD and the linkages that have been conducted. Currently, as you see, there are 5 initial data sets in the iPHD project, all coming from the New Jersey Department of Health, namely the birth data, New Jersey mortality data, hospital discharge data, the New Jersey CDRSS data, specifically COVID-19 PCR positives, and the EMS data. If you're not very familiar with those, I can give you a brief summary on some of these. So the New Jersey birth data contains attributes of the newborn and mother, the mother's prenatal history, pregnancy and birth details, as well as newborn care with procedures and interventions. And currently, this data is available through the iPHD from the year 2000 up to 2021. The New Jersey mortality data that comes from the mortality death certificate data contains information about the deceased, including demographics, date and cause of death. And this data is for New Jersey residents, regardless of where the death occurred. The New Jersey Uniform Billing Hospital Discharge data includes information from inpatient discharges and in-person visits made to hospital emergency rooms and outpatient departments. Some of the data elements include admission and discharge dates, encounter information, such as diagnosis and procedure codes, patient and provider characteristics, as well as total charges and other charges. And the data for the hospital discharge is available from 2010 up to 2022. The CDRSS, more specifically the COVID-19 data from the CDRSS, which is the Communicable Disease Reporting and Surveillance System. This contains information on COVID PCR positive reports, including dates of onset, lab results. Essentially, it serves as an indicator of confirmed cases. And this data begins on the onset of the pandemic, which was in 2020, up to 2022. The iPHD also contains EMS data, which it's details on the EMS response to calls throughout New Jersey. Some of the data elements include information about the scene, such as date and times, the type of transfer that occurred, i.e. hospital or helicopter, and others. It includes relevant medical history and procedures or medications delivered by the dispatched medical response team. And data for this data set is currently available for 2017 up to 2022. So each of these data have different lag times. So by the time for them to get to us, and then we have to process them for linkages. So those are the data sets currently available in terms of the sets and the time frame, but we expect to refresh all of these with an additional, more recent year of data sometime in the early summer, so look out for those. I would also highly suggest that you take a look at the iPHD data page, where you can find more information about these data sets, including comprehensive data dictionaries and also the variable list. And this is important to note because although the dictionaries are very comprehensive of all of the fields available, the variable list will guide you on what specific data elements are available for release. And I can talk a little bit about that in terms of de-identified and limited data sets that are available through the iPHD in the next couple of slides. So some of the value added that the iPHD does here is that we create a longitudinally linked data at the individual person level. So we're conducting probabilistic data linkages to the person level entity. And this is useful not only within a data set, but also to be able to track individuals across multiple different data sets that are shown here and more to come in the future. So we prepare project-specific, de-identified, and limited data sets for approved projects. And we also provide limited technical assistance when the needs arrive. Next slide. So talking a little bit more about the data processing and linkage capacity, as was mentioned before, we've reviewed about 80 million records to date, and more are coming in. And like, for example, with the birth and mortality data, those would be 1-to-1. But then when you have a hospital discharge data set, you'll have many records there, which right now accounts for the most of our data in our set. A person can have several encounters here. And so during this large period of time, you can see for the roughly 60 million or so records, we have identified about 13 or so million individuals. I do want to note that this also includes, there are some out-of-state individuals that we do see, even though it's a small percentage. It also includes records where even if we don't have the appropriate level of information to make linkages, let's say name and date of birth are all missing, we still create a study ID for that record and sort of denote it as an individual. So you will see those records there as well. Next slide. So talking a little bit more about the sort of the type of data that we're releasing. So there are two types. There's de-identified and limited data sets. De-identified data excludes the 18 specific identifiers listed on the screen. So some of those are sort of more obvious, but I do want to draw attention to number 2 and number 3. When it comes to geographic IDs, all the geographic subdivisions smaller than a state, including street address, city, county, Princeton, zip code, and their equivalent geocodes, except for 3-digit zip codes, are excluded in a de-identified data set. And for number 3, in terms of dates, all elements of dates except year for dates that are directly related to an individual, including birth date, admission date, discharge date, death date, and all ages over 89, and elements of dates, including year, such that they get aggregated when top coded at that level. And the rest are sort of more direct identifiers in terms of social security numbers, medical record IDs, biometric identifiers, and others. Next slide, please. The iPHD is also permitted to release limited data sets, which excludes most of the 18 identifiers that were previously described, but it may include one or more of the following. Specifically, dates such as admission, discharge, service, and dates of birth and dates of death are permissible, with the geography, municipality, state, and full zip codes are permitted, as well as ages in years, months, days, and hours. So the iPHD limited data sets released by the iPHD will include only the minimum necessary information needed to complete the approved research project, and the use of an LDS will be governed by a data use agreement. So as I mentioned, there are other data sets that are, we're working on introducing to our set. We've also talked a little bit about how to handle third-party linkages. So this would be for non-iPHD data. So linkages between the iPHD data and other data sets that will be evaluated for technical feasibility and HIPAA compliance to ensure that linkages do not enable re-identification of individuals. And additional fees may apply for linking external data. So more to come on that.